I had to develop this procedure because the classic procedures used in public health and epidemiology were not pertinent to the kind of question that a judge would ask when looking at one case at a time. And therefore, I had to figure out a way of estimating the number of people who would satisfy a certain criterion without bringing them into court one at a time. It obviously would be impossible to parade 100,000 people in front of the judge during the trial, but I had to figure out some way to get him to understand how many would have satisfied the criterion of more likely than not, even if he didn't see them individually. In the end, it turned out that over 90% of lung cancer patients in Quebec do satisfy the criterion that the judge finally established. He established that criterion based on my calculations of at what point in the amount that a person smokes, their risk becomes so great that it's more likely than not that the smoking caused it rather than something else. Having made these calculations for the judge, he decided, with guidance from my calculations, that somebody who smoked approximately 85,000 cigarettes, and I won't describe how I arrived at that figure, but someone who in their lifetime has smoked approximately 85,000 cigarettes satisfies the criterion very confidently that if they got a lung cancer, more likely than not, it was caused by the smoking.